When the MS nurse first mentioned hospice, it was quite frightening really, because I always imagined hospice as end-of-life care.
I'd first heard the word hospice years ago, so the thoughts of coming to St Barnabas wasn't a daunting thought. I can understand how it is a daunting thought for lots and lots of people, because they tend to associate hospice as end of the road, last resort.
You think St Barnabas Hospice, you think, but having come, it's a very nice place. It's not what you expect. It's very friendly, open, and I'm just having a good time.
Initially, I remember going to see somebody in St Barnabas Hospice, and obviously I think that vision came into my head at first, and so I wasn't aware of a day therapy unit. When I came, I got a big surprise.
Some of our patients might access many of the complementary therapies that we offer, which would be things like Reiki, Indian head massage, reflexology. We also have seated adapted Tai Chi that patients and their carers can come to.
In another 2 weeks, on Wednesday 2 weeks, I will have the mastectomy, or at least that's planned.
Okay.
When my cancer returned a third time, I had all this information in Lincoln Hospital of everything that will help people in my situation, or any other cancer for that matter. I was asked whether I would like some therapy, relaxation, and the Indian head massage I'd had some years before, and so I decided to ask, and I was given, this is my third treatment today. I was offered that I could come here to this day centre. All I can tell you is it releases tension. So obviously it gives me a better day.
St Barnabas is a central part in terms of managing my condition. It's enabled me to benefit from services such as physiotherapy, benefit from services in terms of relaxation, and I will hopefully go on to do other activities with St Barnabas.
This is not as easy as it looks.
No, we ought to let them have a go.
Especially in high heels.
It hit me very, very hard, because I've worked all my life, always been very active, and it was a very nasty experience, to be honest with you. When I was discharged from hospital, obviously I couldn't live on my own, so I came to live in Lincoln with my daughter, with the hopes that I would recover and be able to move back and look after myself, but that didn't happen, and it's just not going to happen. I've accepted that now. So that's how I came to live here. My initial diagnosis when I was taken into hospital last August was severe respiratory failure, and I was in intensive care for a few weeks, and from that they discovered right side heart failure. I'm really looking forward to making new friends of my own, and they're going to be people in the same position as me. So yeah, I'm really looking forward to it.
The only thoughts I'd ever had about hospices were from where I lived previously, and I assumed that they were for cancer patients. I didn't realise that they were very good at picking up other chronic conditions. We're doing reflexology today. In therapy, you are asked specific questions or actually given homework like having a sleep diary or an activity diary. You can make vague feelings become more concrete and useful tools for changing perhaps bad habits or finding out different ways, easier ways of coping with things.
The important thing is there is so much for people to do. There's no need for them to be miserable at home. I am absolutely convinced that there are many people who are on their own at home and could do with coming here and talking and meeting with people. It is a lifeline for me. Getting out of the house. It's all bright and cheerful here. Everybody, there are people to talk to, which is very important in my view. And, you know, meeting people, communicating and that sort of thing.
She was like a special clinical nurse manager that I had, and she referred me to the hospice. And it wasn't long before I heard from them, and I came along and had an assessment with the nurse here, one of the nurses here. I've had physiotherapy for my chest because I have bronchiectasis as well as multiple sclerosis. I've had relaxation, going to be put forward for the Tai Chi. But it's like, I don't know, it's like a family here as well. The staff are so friendly. There's always support there if you're feeling a little bit down. They do recognise it. You don't have to say, they just pick up on it, you know, without you having to say anything.
Often people come to us perhaps in a stage of crisis. They've been referred because they've hit a bump in the road, their circumstances have changed, they've maybe become more poorly, they've maybe just finished some chemotherapy and they're feeling particularly rotten. And we can offer these services to pick them up, to set them straight again, to put them on the road to seeing that there's more that they can achieve. It is a rehabilitation, it's getting used to a new way of viewing their life, but of living their life to the full. So yes, the services, even whether it's physiotherapy exercises or whether it's some gentle complementary therapy, they're all of equal value and they all help to pick up the pieces, as it were, and help them live their life.
To me, I feel quite emotional thinking about it. They were there when they threw me a rope and I was very glad to hang on to the end of it.
It's helped with my life overall. I feel a lot better and my health and everyday life is a lot better with coming to St Barnabas.
It's helped me to get out much more and live instead of just existing, which is what I was doing.
Country road, take me home to the place I belong, West Virginia, Mountain Mama, take me home, country road.